Hi, my name is Dr. Amee Daxini and I practice in my own clinic called Think Skin Clinic in Sarjapur, Bangalore. So facial contouring is what we all look for. As we start aging, we notice that there is sagging of our skin, the lines and wrinkles that are developing. You notice your smile also downturning. You notice your eyes becoming a little deeper, going inside the sockets. And that's where you feel that there should be a better contouring. If you look when you're young, your face is an inverted triangle. And as we age, it becomes a proper triangle and sometimes even a square. So a good contour will give us that lift which will prevent aging and also make us look better. As dermatologists, we have a lot of weapons in hand to actually deal with this. I'm going to cover just a few very quickly. The first, which is I think the most favorite, is the botulinum toxin, or commonly called Botox. Botulinum toxin works on the muscles. So when we start aging, you notice that your frown develops or your forehead lines develop, or you start noticing crow's feet around your eyes. This is because of the use of the muscle of expression. So when we use the toxin and when we put it into the muscle relaxes. And when the muscle relaxes, the lines are not visible even when you're actually using them. The other thing a botulinum toxin works is on our muscle over here. Many a times when we clench here, we have a very, very strong muscle and it can be looking like a square face because of a protrusion of this muscle, which is very strong. The toxin then we can inject into this muscle, relax the muscle so that you get a good chiseled look. So the first one in our armamentarium is toxin. The second, which is very common, are the dermal fillers. Now in India, we generally use the hyaluronic acid fillers because hyaluronic acid normally is present in our dermis, which starts becoming less with age as well as external exposures. Now, injecting this hyaluronic acid where the volume has reduced, where we feel that we need to fill that up, like probably your laugh lines, like your cheeks, which you need a little lift over here so that the sagging reduces and you get a good jawline. You use dermal fillers even for hydration, for reduction of open pores under your eye to reduce the depression that you notice called the tear trough. So fillers are beautifully used to actually chisel the face and give it a beautiful permanent look like your nose bridge or your temple. So you get a beautiful look there with dermal fillers. The third thing that we commonly use again are called threads. Now as the toxin works on the muscle, the fillers work in giving you more volume, the threads help us to move the fat pads. So as we age and due to gravity, the fat starts coming down and that's when you notice your jowl or you notice double chin. Now what threads do is, because the threads have barbs or certain projections which can pull that fat up there, we put the threads in areas where the fat is dissociated and we get it back into position. So that's when you can contour your face, chisel your jawline and get a good look without the sag. There are other procedures also that we do as dermatologists. One of them is cool sculpting, where we use chilling or cooling down of the fat to that extent that the fat in the skin gets necrosed and that then is removed by the body. So if you have a very prominent double chin which is not giving you a good jawline, is where we use cool sculpting. All these procedures, remember, should be done with a good home care of anti-aging creams and serums, and don't forget your sunscreen.